Good afternoon, Madam Chairman, ladies and gentlemen. The topic for today's debate is burnout among healthcare workers. Burnout among healthcare workers have become significant concern in recent years, as it is not affect well-being of the individual, it also affect the quality of the patient care they provide to the patient. So, today's debate aims to explore the factor contribute to burnout among healthcare workers, its consequence, and the solution to elevate this issue. Okay, in my opinion, factor that cause burnout among healthcare workers is short of staff. Short of staff occur due to the lot of tasks given at one time, long working hours, quality of patient care, and work schedule. For example, single medical staff have many patients on day shift but still need to work on night shift. Other than that, instead of being involved in long hours of operation theater, they also need to train and educate new member of medical team and at the same time join hospital awareness program. This put them under pressure, so as a result, they will feel tired, stressed, and moody. Moody affect their professional as healthcare provider because their expression and the way they treat patients slightly change.
Okay, thank you Ellie for your point. As our topic for today, I think that I have my own personal point, which is interpersonal conflict. Let me specify more about this conflict. As we can see in the hospital environment, it could involve a fellow of the radiographer, nursing students, patients, and the other colleagues. Interpersonal conflict among the healthcare workers can have detrimental effect on the patient care, staff morale, and overall workplace. Preventing such conflict is crucial for maintaining a healthy and efficient work environment. As we all already know, the work environment that are characterized by the high level of the role conflict are more difficult and unpleasant setting in the work, and it may lead to the extra effort. There is a journal that is written by Michael P. Litter from the psychology department at the Acadia University in Canada that go through in detail about these things.
Alia, may I interrupt?
Sure.
Addition for Alia's point, prolonged interpersonal conflict may lead to emotional strain. Despite interpersonal conflict with colleagues, this also can happen between staff and patient, including patient's family. This occurs when healthcare staff face intensely stressful and emotional situation in caring the patient. When dealing with suffering and pain patients, as well as their families, can take a toll on healthcare. Therefore, I strongly believe that interpersonal conflict is the cause of burnout among healthcare professionals. That's all I want to add. Thank you.
But from your point, I can see that interpersonal conflict can lead to emotional strain, right? But in my opinion, emotional strain and also interpersonal conflict is rise from the problem short of staff. For example, when the healthcare professional was asked to do night shift, for example, like from 6 p.m. to 5 a.m. and they are also in charge for the next day shift, which is day shift tomorrow at 8 a.m. So they need to wake up early and they might feel exhausted because they lack of sleep and feel tired and feel sleepy, which make them can't do the job properly. And I think this will getting worse if the working hour for every staff member is different, which this can make them feel unsatisfied and or jealous with other staff. And then this also can lead to interpersonal conflict. And their packed working hour due to not enough healthcare professional causes a change in the sleep pattern of a person. And according to the previous research, a healthy sleep person is supposed to be 7 or 8 hours. And if people who sleep less than 7 hours, they may have a higher chance of getting health issues. So these health issues will negatively impact to emotional well-being. That's all from me.
Sorry to interrupt, but I think your point can be solved by emergency hiring. So this process aims to quickly fill critical position to meet patient care and operational needs. So each of department must identify whether they need a new staff or not. So it is because we must determine which position are most crucial for patient care and functioning of hospital. So hospital may also consider temporary staffing solution, including thinking of hiring local tenants or per diem workers to address immediate staffing needs. So if you think that emergency hiring will be costly, so we can retain our current staff. So it is crucial for maintaining continuity of care, ensuring institutional knowledge, and fostering a positive work environment. So to retain current staff, hospital can implementing a clinical recognition program offering flexibility and provide meaningful work to improve job certification and reduce attrition rates. So I think that's all from me.
Okay, so yes, I agree with Fika's point just now, but emergency hiring is not a proper way to solve the shortness of staff. Why? Because it's very hard for us to hire a new medical staff in a very short time. So they need to undergo a few specific procedures before become a true medical staff. Hence, for example, they need to undergo interview, okay, they need to be training, and also fresh graduate staff cannot do all the patient care by themselves. So they still need the guidance from senior staff. Alright, so I still believe that shortness of staff is the problem in healthcare. Why? Because it will lead to burnout among medical staff. So it's due to long working hour, just like Mel just now stated that long working hour may lead to exhaustion, stress, tired, as well as medical staff that cannot rest well. So they will lack of sleep. Okay, so all these factor is the factor that contribute to burnout among medical staff. So when the staff experience burnout, they will affect the department they work in, as also the quality of service that they provide to the patient. So the poor quality given to the patient may increase the risk of medical error, as well as it will affect the patient safety. So hence, burnout is caused by shortness of staff, and it will lead to poor quality of service that provided from the healthcare professional to the staff. That's all from me.
Okay, sorry Ruby, but here I want to emphasize that interpersonal conflict is the factor of the burnout. So I want to add some points about the interpersonal conflicts, which is, for example, some patients' families are overprotective towards the patient. Those who lack knowledge about hospital procedures tend to question every action of staff, and some of them also feel skeptical with the procedure if the procedure is safe for the patient. This leads to staff thus being interfered and will put pressure on them. From interpersonal conflict example that I have emphasized earlier, it can lead to personal strain. From the pandemic was also highlighted through behavioral and psychological difficulties. Changes in behavior included reduced sleep, reduced eating, overreacting, poor diet, increased anger, lack of tolerance, being distracted, making mistakes, tearfulness, self-harm, getting started easily, and avoiding going to work. Emotional strain also can occur when the staff mainliness face a lot of heavy and emotional events, such as when treating badly injured patients that are admitted from a big accident and observe patients dying in front of them. So that's all from me. Thank you.
Yes, I understand that, but I want to elaborate more on why I did not agree with Hasana's point. For me, interpersonal conflict can be overcome with effective communication. It is one of the most important factors in preventing interpersonal conflict among healthcare workers. This can be done by fostering open, honest, and respectful communication.
Healthcare professionals should be encouraged to express their concerns, opinions, and ideas in a constructive manner, without fear of retribution. This can be achieved through active listening, conflict resolution technique, and clear communication channels. Next, team building exercise and activities also can help improve relationship among healthcare workers and promote a sense of unity. Promoting a positive work culture also can be applied to overcome interpersonal conflict. A positive work culture can have a significant impact on preventing interpersonal conflict among healthcare workers. So, I want to conclude interpersonal conflict is not the main factor lead to burnout, as the healthcare personnel can overcome the conflict by themselves.
Sorry, I want to add. So I agree with Hani. I believe that short of staff is a major factor of burnout. That is because a short of time can lead to packed work schedule due to insufficient staff to fill working time per week. Okay, that's all.
I'm sorry for interrupting, but every problem has its own solutions. There are some solutions that can cure a packed work schedule. First and foremost, a stressed healthcare worker can apply for a compassionate leave. This kind of leave is granted to employees who need to take time off work for their personal reasons, like caring for sick family members or attending to a personal matter. In our country, Malaysian employers offer 2 to 5 days of paid or unpaid compassionate leaves. Hence, healthcare workers can let their head down without worrying about their packed work schedule, since they can use these 2 to 5 days of leave by spending time with their family members. By doing this, they can eventually focus on their self-care and resume their work without affecting the quality. Not only that, they can also reduce their burden due to the packed schedule by asking help from their colleagues to assist them, so they can finish the task together. As saying goes, many hands make the light work. Hence, by doing this, they can eventually reduce their burden of working alone. I think that's all from me. Thank you.
Okay, so I would like to add to Ani's point just now based on my research. So, according to a study, the prevalence of burnout among the nurses working in USA and also Europe has been reported. The range of burnout happens between 25% and 37%. So, this proves that working schedule has only small percentage effect on the burnout. And then, according to another research, providing the statistic of prevalence of burnout during COVID-19 pandemic among healthcare workers, I found out that nurses and doctors who usually have long working schedule than other healthcare professionals have a higher personal-related burnout than the patient-related workout and work-related burnout. And then, so these prove that the problems they may face are like having direct contact with COVID-19 patient, medical conditions, inadequate self-perceived psychological support at work, and inadequate childcare support were significantly associated with personal-related burnout. Thus, I think work schedule has only a small significant effect to cause burnout among the healthcare workers. Thank you.
Okay, first of all, I want to give a voice about Ani's opinion related to backward schedule. As Anis mentioned earlier, healthcare worker can apply for compassionate leave. But as you know, the leave is not for workers to have a rest. Instead, spend their leave for personal problems such as taking care of sick family. So from here, the leave doesn't reduce their burnout, but in fact added more their burnout. And also, I want to against the point where the worker can focus on their self-care, because the purpose of the leave is to take care of sick member or if one of the family members dies, and not because of the personnel itself.
is sick or to have a rest. So from here, I can conclude that compassionate leave is not a solution for a packed work schedule. Even though there is other leave, but it is not easy to apply for just 1 day leave. As you know, if you want to apply for 1 day leave, you have to find another person to replace you. So it's not that easy. So another is another point of Anis where the personnel can ask colleague to assist them. So I think just now you have mentioned that internal personnel conflict is the factor to burn out. But how are you going to ask your colleague to replace you if you have interpersonal conflict? So the next one is for Mira's statement, which is work schedule has only small percentage effect to cause burnout. I really believe their prolonged effect can lead to become crucial factor to burnout. So it might be small, it might seem small, but it really have big impact to the personnel itself. So here I'm firmly state that short of staff is the only and main reason to cause a burnout among healthcare profession. That's all from me.
I agree with Isma. A packed work schedule due to the irregular shift has become crucial cause to burnout. Many healthcare professionals work rotating shift which can disrupt their sleep pattern and lead to the chronic sleep deprivation. This can exacerbate the effect of stress and contribute to burnout. That's all from me.
I want to add some information. As you can see here, this is a Dr. Estila Nathan said from Malaysia Medical Association said that staff also complain about long working hours. 24 hours on call followed by 8 hours the next day has lot negative effect on doctor and contribute to medical error. It also states that the main cause of stress among HO during a study done by IHM in 2008. And here, as you can see, as evident about HEPFAT 2022, one doctor need to treat 420 of patient every day. So it show really big ratio. And even Singapore has 2.7 doctor per 1,000 population. And I want to state that like you say yearly KKM have hired many fresh graduate, but did you know that all of them are contract worker? As example, we can see previous situation during pandemic. I know that they hire fresh graduate student to give hand to settle the workload. But the key issue is they are employed under contract. They are not permanent employees. So this situation actually cannot cover our staffing shortage issue. That's my evidence, as I think short of staff is actually the main factor of burnout. Okay, that's all. Thank you.
Based on our discussion just now, my team has come out with conclusion that short of staff has left many bad impacts leading to burnout among healthcare professionals.
We also still with our opinion about short of staff is still reason for burnout among the healthcare workers. So we can conclude here that short of staff is the main and only factor of burnout among the health workers.
Yes.
Thank you.